we're going to see is a lot of people who are just, their biggest medical problem is that they're poor. The diet is strictly potatoes, rice. We're going into Pucasana, which is a fishing village, but yet the people cannot afford to eat the fish. They have to sell it in Lima to the restaurants that make enough money so that they can support their families.
3.500 personas en toda esta.
There are 300,000 people living in this slum, and there are only 3 doctors for the entire population. Yes, only 3 doctors.
Para toda la población, sí, toda la población, 3 médicos.
Yo vivo acá con mis 2 pequeños hijos, vivo sola, trabajo.
I live here with my 2 children. I live alone, I work, and life here is difficult. Our community lacks light, water, and other public amenities. We lack the necessary basic things to live here.
El alumbrado público, agua, lo necesario, ¿no? Las cosas básicas para vivir acá.
When you see so many people in such poverty, and the main issue is that they're poor. A lot of them have similar illnesses, and a lot of them they have access to the medicine they need, but they just don't have enough money to buy it. Or
it was just very humbling to see how people can live in such poor conditions, where their houses are literally foundations of tires and then 2x4s stuck in the ground with tin leaning on them.
Esta zona le llaman la chanchería.
This area is called the butcher's shop because it was used for pig farming. No one wants to live here, but this is the only place we can live and have a home.
Y por la misma población, que a veces la necesidad de tener un hogar, uno tiene que vivir así.
So it's hard to see so many people, and it's such a daunting task to try to help all these people.
And poverty breeds poverty unless we inject education and help, and we start to do some grassroots work to alter the path of poverty. I think what sets Project Cure apart is that the goal and overriding objective in everything that they do is long-term sustainable healthcare improvements.
What's good about it, it's going into countries where we think, oh, we're poor. You go into these countries and they are really poor. And they just do great work in that sending hospital equipment to all these countries, and then they're able to use it.
They really do try to focus on sustainability by sending what the country needs, and doctors to teach, to educate the people here what they can do better.
Doing the hospital tour and just seeing how many of the things in the hospital had a Project Cure sticker on it. Without the things that Project Cure had provided, I think it would be hard for them to call it a hospital.
But you're making an impact directly on these people's lives in ways that they couldn't have dreamed of being helped. They have no access to proper medical facilities, but Project Cure brings that to them and provides care that they wouldn't be able to receive otherwise.
Es la primera vez que trabajo con una organización.
This is the first time that I have worked with an organization as large as Project Cure. Project Cure is a very ambitious organization. It works to help the entire community. It's massive. The help that they give here is for everyone.
O sea, Project Cure es masivo. La ayuda que da acá es para todos.
All the doctors that Project Cure helps are people who have invested a lot of time and their own money to learn about medicine, and Project Cure is an organization that provides them with the tools to the best of their ability so that they can use their knowledge and passion to actually help people. Thank you to our friends at Project Cure who have come to Lima to help us. We are organizing a health campaign that the people need immensely. Many of these people do not have the opportunity to go to a hospital and see a specialist, and this campaign offers them that opportunity. But the main focus of Project Cure, I think, is to empower doctors where they are to serve the people that need the help. And to do that on a sustainable basis, not just give containers to as many hospitals as possible, but give people what they need when they need it, and if they need more later on, keep providing them with with the tools to do the best that they can do.
Las campañas médicas, la gente siente
Through
que
the medical
en ellas
campaigns, Project Cure is able to let these people know that someone cares about them. By the way that the doctors treat the patients, they are saying, "We love you and we care about you." I think this touches people's hearts and we are
te
grateful.
queremos. Nos interesas y te queremos. Y yo creo que eso llega mucho al corazón de toda la gente acá. Están muy agradecidos.
Y eso es especial. O sea,
It is special to see how
ver la
happy these people are
predisposición de
because
la
of the help that
gente
they're
al
receiving from the
ayudar,
Project
siempre
Cure
con una
team.
sonrisa, siempre
They are
tan
constantly
amables.
smiling, which is
Y eso no
unusual.
es normal.
We are all encouraged to
Eso no
move
es normal.
forward.
No todos
This is
tienen
very
esa
good and the
predisposición.
happiness is
Y eso es bueno
contagious.
porque te contagia y te da ánimos a seguir adelante.
It's awful easy to sit in America to where that we're so blessed with everything to really not see the need out there in the world.
Project Cure is an organization that does a lot of good for a lot of people, and I'm very glad to be able to say that I work with Project Cure and that I'm able to volunteer my time because I know that with Project Cure the time that I spend is not wasted time.
I think if you go into medicine to help people, and a lot of the people we see aren't necessarily that sick at home, and it's pretty easy to take care of them, whereas here everything's a struggle. I actually don't know why, it just feels really, really good to be here doing this work.
Yes, we provide lots of service and we invest lots of money and we provide lots of medical equipment and products, but all that being said, there's no question that I gain more personally than I give. And
it definitely rejuvenates me, actually, strangely, for my care back in the United States.
One, it was rewarding from the standpoint of making a difference in their life. It was rewarding from the standpoint of being able to be part of a team that is very high caliber.
So it's just awe-inspiring to make a difference, to step out of my comfort zone and try to help people in any way I can.
It's rewarding. I've been able to do this a goodly number of times, and it's something I've been given chance, knowledge, experience, and training to do, and so you sort of do what you can do.
Seeing the poverty firsthand and seeing what Project Cure is able to do and how it's able to directly affect these people's lives was very empowering, and makes me want to do all that I can to continue service with Project Cure.
As my old friend said, you do all the good you can to every person you can, in every place you can, in every way you can, as long as you can. And that's what we've tried to do.